You are lying face down on the hard dirt. Dust clings to the cold sweat on your forehead. A searing pain rips through your chest every time you try to breathe. Your leg just snapped from a terrifying fall during a hunt, and you are bleeding. Look around. There will be no blaring ambulance sirens. There are no nurses in white coats rushing toward you with a stretcher and an oxygen tank. There is no smell of antiseptic, no brightly lit emergency room, and certainly no painkiller being injected into your veins. Not a single doctor in the world is coming to save you, because the very profession of a doctor does not even exist yet. Right now, surrounded by a vast, untouched wilderness, the only things around you are intensely familiar faces. These are the members of your tribe. They are wearing animal hides, their hands stained with mud. They look at you with deep concern, and then, without a single word of instruction, they spring into action. One person drops their weapon and sprints deep into the forest to find specific leaves. Another frantically gathers dry branches and strikes a fire. Someone else drops to their knees right beside you, wrapping their arms around your shoulders, holding you down so you don't thrash around in a panic, and constantly whispering soothing sounds. Lying there through the blinding pain, you have no idea if you will live to see tomorrow's sunrise. But there is a bizarre truth that history has proven. Countless people just like you, in that exact desperate situation, actually survived. So, the question is, how did our ancestors manage to survive and keep humanity alive for hundreds of thousands of years in a world completely devoid of modern medicine? How did they overcome severe bone fractures, gaping wounds, deadly infections, or highly risky childbirths, when all they had in their hands was whatever wild nature and their tiny community could provide? Most of us living in the 21st century carry a very deep-seated assumption. We tend to think that in prehistoric times, humans were incredibly fragile against disease. We assume a tiny infected cut, a fever, or a single rotten tooth was enough to wipe out an entire tribe. We picture their lives as incredibly short, brutal, and believe that anyone who made it past the age of 30 only did so out of sheer, miraculous luck. But the reality is infinitely more complex and magnificent than that. It is true that the mortality rate in the ancient world was very high, especially for infants and toddlers. But for those who made it past childhood and entered adulthood, they were often cared for with astonishing dedication. They didn't survive blindly by luck. They survived because they possessed a treasure trove of indigenous medical knowledge, incredible survival skills, and most importantly, a robust social support system that we modern humans often ignore or severely underestimate. Let's look back at the scientific evidence to see how our ancestors essentially acted as doctors for one another. The first piece of evidence, and perhaps the most moving one, comes from ancient skeletons. At the Shanidar Cave in Iraq, archaeologists discovered the fossilized remains of a Neanderthal man named Shanidar I. This man lived about 45,000 years ago. When scientists examined his skeleton, they were absolutely stunned. Shanidar I was blind in one eye from a massive blow to the face. His right arm was withered and had been amputated right above the elbow. He had a fractured collarbone, permanent damage to his right leg that left him with a severe limp, and he suffered from profound hearing loss. If he lived in a ruthless survival of the fittest wilderness, like we usually imagine, Shanidar I should have died the moment those injuries occurred. A blind, limping, one-armed man cannot hunt or forage for himself. But the miracle is, his bone structure shows that these injuries healed, and he lived for many more decades, passing away in his late 40s, a remarkably old age for that era. This points to only one possible conclusion. The members of his Neanderthal tribe did not abandon him. They chewed his food for him, protected him from predators, brought him water, and nurtured him day after day, month after month. Collective care was humanity's very first hospital. The second piece of evidence will shatter all boundaries of what you thought prehistoric people could do. Stone Age surgery. Recently, in a cave in Borneo, Indonesia, scientists excavated the skeleton of a young adult who lived at least 31,000 years ago. When they looked at the left leg of the skeleton, they discovered something unthinkable. The lower third of this person's left leg had been amputated in an incredibly clean, precise, and entirely intentional manner. The cut wasn't caused by an accident or an animal attack. It was a surgical amputation. Just try to imagine the difficulty of this. 31,000 years ago, there were no stainless steel scalpels, no anesthesia, no antibiotics. Those prehistoric surgeons used razor-sharp flint blades to slice through skin, flesh, blood vessels, and saw through bone. They had to know how to stop the bleeding so the patient wouldn't bleed to death. And the greatest part is, the severed bone healed perfectly and grew smoothly. There were no signs of severe bone infection. This patient survived that horrific major surgery and continued to live for at least another 6 to 9 years. This is clear proof that our ancestors possessed unbelievably sophisticated surgical skills and post-operative care abilities. So what medicine did they use to fight the pain and the infections? The third piece of evidence lies in the dental plaque of ancient people. By analyzing the fossilized plaque on the teeth of Neanderthals, scientists found DNA traces of many plants that hold zero nutritional value, but possess incredibly potent medicinal properties. They found traces of yarrow and chamomile, plants that taste very bitter but help soothe stomach aches and act as antiseptics. They found traces of poplar bark. Poplar bark contains salicylic acid, which is the exact precursor modern medicine uses to manufacture aspirin today. Even more mind-blowing, on the teeth of a Neanderthal suffering from a dental abscess and a severe stomach parasite, they found traces of the penicillium fungus, the exact fungus that produces the famous antibiotic penicillin. Prehistoric humans weren't just picking bitter leaves and mold to eat as food. They knew exactly which plants in the forest could soothe pain and which could eradicate bacteria. They were nature's genius pharmacists. And when faced with open flesh wounds, their treatments were incredibly practical and effective. Without sterile gauze, they used honey. Wild honey has extremely high osmotic properties, drawing water out of bacterial cells and killing them, while also producing a small amount of hydrogen peroxide, a natural antiseptic. They used clean clay or ash from the fire to sprinkle on wounds, which helped stop the bleeding and dry the surface. They knew how to melt birch pitch, a highly antibacterial resin, to smear over cuts. When someone broke a bone, they used straight branches, packing them with clay, or binding them tightly with tough vines to make a splint. And fire, aside from keeping them warm, was used to sterilize stone tools before touching a wound, or used directly to cauterize necrotic tissue and stop the spread of infection. Finally, the fifth piece of evidence regarding their survival lies in their lifestyle itself. A lifestyle that forged a natural suit of armor. Population density during the hunter-gatherer era was extremely low. Humans moved constantly in small bands. Because they weren't packed tightly together in crowded cities overflowing with waste, and didn't live in close proximity to tens of thousands of livestock, they rarely faced horrific contagious pandemics like the plague or cholera. Furthermore, their diet was incredibly diverse, sourced from hundreds of types of roots, berries, nuts, and wild game. Combined with walking dozens of miles every single day, their bodies boasted an immune system of steel. Studies on the Tsimane tribe in South America today, people who still maintain a hunter-gatherer lifestyle, show that they essentially have no concept of modern chronic diseases. A 60-year-old Tsimane man has blood vessels as elastic and healthy as a 20-year-old in the U.S. Our ancestors might have died from breaking their necks falling out of a tree, but they didn't die from heart attacks, obesity, or type 2 diabetes. Now, let's rewind the tape and recreate that exact moment you broke your leg at the beginning of the video, to see how the healing process would actually unfold. When you fall and your shin bone snaps, the entire group stops immediately. The hunting schedule is completely canceled. They do not leave you behind in the woods to fend for yourself. The strongest members will either carry you on their backs or craft a makeshift stretcher out of branches and animal hides to haul you back to the safety of the camp. Once there, they use clean water from a stream or leaves containing antibacterial essential oils to wash the dirt out of your mangled wound. They take a sturdy piece of bark, straighten your leg out amidst excruciating pain, and tie it tight with plant fibers to create a splint. They smear wild honey or sprinkle campfire ash over the open wound to ward off flies and bacteria. Then, they place you right next to the central fire. For many weeks, maybe even months, you cannot walk. But you do not starve to death. Every single day, the rest of the tribe goes into the forest, brings back meat and fruit, and gives you the best portions so you have the strength to recover. They bring you water. They help you relieve yourself. They change the poultice of leaves covering your wound. You have to endure horrific physical pain, but mentally and emotionally, you are never abandoned. Slowly, your bone begins to knit back together. The wound closes. You are able to stand up, walk with a limp, and ultimately return as a useful member of your tribe. But this is where things get truly bizarre and thought-provoking. Our ancestors didn't just know how to passively bandage minor wounds. They knew exactly when it was necessary to intervene ruthlessly to save a life. Their decision to amputate the child's leg in Borneo 31,000 years ago represents a massive cognitive leap. They had to understand the concept of necrosis. They had to observe and realize that if they left the rotting flesh attached, the poison would spread upward and the entire body would die. They accepted causing agonizing pain, accepted a massive life or death risk at that very moment, in exchange for a slim chance of survival for the patient. And the most stunning part is, this entire treasure trove of complex medical knowledge, how to stop bleeding, how to splint a bone, which plant contains antibiotics, was all transmitted orally. There were no medical textbooks. There were no universities. It was a form of community medicine, where knowledge was stored in the memories of the elders and passed from one generation to the next through stories told around the campfire. Now let's do a direct comparison with our modern world. Today we have medicine that feels like magic. We have antibiotics that eradicate bacteria in a matter of hours. We have anesthesia that puts you into a painless sleep. We have robotic surgical arms precise to a fraction of a millimeter. That progress is undeniable and has saved billions of lives. But there is another, much more bitter truth that exists alongside it. When we get sick, injured, or diagnosed with an illness, so many of us experience profound, soul-crushing loneliness. When you are lying on a sterile white hospital bed, surrounded by the cold, indifferent beeping of machines, you are often lying there alone. We make a phone call to a stranger in a white coat instead of having an entire tribe gathered by our side. Our ancestors frequently lost their lives to acute physical trauma or infections because they lacked antiseptics. But ironically, we today are slowly dying from chronic illnesses, from extreme mental stress, and from the isolation and fracturing of our social connections. They lived in a wild world full of deadly hazards, but they were enveloped in a thick, warm web of social support. We, on the other hand, live in the safest cities in human history, yet we routinely face pain and illness, entirely alone. So, when looking back at this entire picture, perhaps the most accurate question isn't, how did our ancestors survive without doctors? Instead, the question should be, what precious thing did we accidentally lose when we turned healing into a commercialized service, a specialized job reserved exclusively for a select few wearing white coats? The next time you catch a cold, get a bleeding paper cut, or find yourself tossing and turning with a fever, remember your own deep history. Remember that your body possesses a miraculous design, pre-programmed to recover and heal itself. as long as it is placed in the care, love, and presence of a community. Our ancestors did not have clinics. They did not have doctors. But they had each other. And for a human being hovering on the boundary between life and death, sometimes the presence of your fellow humans refusing to abandon you is the absolute greatest and most powerful medicine of all.